Okay on my side.
And okay on mine. Hello, everyone. My name is Veronique Mead, and I'm a former family doctor and assistant professor of teaching in a family practice residency program and a trauma therapist. And I share the information and the research about trauma as a risk factor for chronic illness on my blog, Chronic Illness Trauma Studies. And I'm here today. Thank you so much, Guy McPherson of the Trauma Therapist Project, because I get to host someone for your guest host series. And I met psychologist Dr. Tony Madrid 25 years ago at a conference where his findings with reversing asthma in kids kind of rocked my world. So my interest in having Tony here today is to really share the potential degree of reversibility in chronic illness. So Tony, take it away and tell us what you've been learning over the past 30 years.
Thanks, Veronique. The group I work with, Redwood Psychology Center, discovered a cure for asthma. We discovered it accidentally. And here's how it happened. A 7-year-old boy with severe asthma was brought to our clinic to get some help with his asthma. He was severe. He missed school several days a month. He was on rescue inhalers all the time, on a full spectrum of medications, and he frequently ended up in the emergency room. His mom brought him in, this little boy, and we did everything we could to help him, and nothing worked. The mother, however, continued to get some counseling for herself. She was a student at the university here in town, and a single mom, and she talked to us about the usual things that troubles students in college. And one day she looked wiped out, and we said, how come you're so exhausted? And she says, I was up all night last night with my son. I had to bring him to the emergency room again. And what's really funny about this is that even though I do everything I can for this boy, I don't have any strong feelings for him. I don't feel like I love him. Well, that opened up our eyes, because that's exactly what Klaus and Kennel, two neonatologists at Case Western in Cleveland, what they said happens with the mother who doesn't bond. And they talked about maternal infant bonding, brought it to the world. And what they said was that if a mother doesn't bond, she's going to not feel tremendous love for the kid. And here's what happens. Here's what brings about non-bonding. If the mother is separated from the child at birth, if she has grief in her own life with the child at the time of birth or during the pregnancy, the chances are she's not going to bond or fall in love with her baby. So we said to her, what happened during the pregnancy? And she says, oh, it was a train wreck. The father of the baby ran away and left me all by myself. And we went to the hospital when I was ready to deliver, and my mother accompanied me to the hospital, whom I don't like at all and criticized me throughout the entire delivery process. I had a nurse who was mean to me, and I found out she was mean to everybody who was on Medicaid. And the doctor who followed me through the pregnancy couldn't make it to the delivery, and I had a new doctor. And then my son was born sick, went to the neonatal intensive care unit, and stayed there for 6 days while I went home. And when I came back and got the baby, I looked at the baby and I said, are you sure this is my baby? And that was a clear indication that she didn't bond with the baby. So we tried a couple of things. We tried hypnotizing her to relieve all of the conflicts during her birth, during the birth of the baby. And after that was done, and it was done quickly because it was 7 years ago that all this stuff happened, so she had resolved a lot of it through time. And then we had her imagine a new birth. That was the last of it. We kept on seeing her for a couple of months, and then she was going to leave the state, and mentioned on the way out the door She said, remember that time we did the thing about the hospital? And we said, no, what do you mean? She says, remember you changed the birth? And I says, oh yeah, we remember that. She says, my kid's asthma went away that day. Went away. She says, no more medication, no more wheezing at night, no more emergency room visits, and the only time, and no more medication. And the only time that it came back was when he was visiting his father up north. Father phoned me and said, hey, he's got wheezing. He's wheezing again. And I said, bring him home right away. He came right back home. I grabbed him. We sat down on the couch and the wheezing stopped and has not returned. What?
I have to say, I share this story all the time, Tony. It's just something we don't hear about in medicine, and it's just so dramatic.
Yeah, it is. Thank you. Yeah.
Yeah, yeah.
So we started searching around and saying, I wonder if there's any other kids in this clinic who have asthma. And we found a couple. And sure enough, we did the same thing with the mothers, not with the kid, with the mothers. And the asthma went away. Let me give you an example. With the asthma went away. There was this mom whose kid was asthmatic, about 9 years old, and she was in the clinic seeing something for some other reason. And she mentioned that her kid had asthma. And we said, well, what happened at the birth? And she says, oh, I had a baby die of crib death 6 months before I got pregnant. So we said, that's a indication of non-bonding. So we did the same thing, cleared out the grief that she was feeling about the crib death baby, had her imagine a new birth. Bingo. Within 3 days, the kid's asthma went away. And she phoned us and she said, I got to tell you, I'm looking out the window at my boy who's playing soccer in the backyard for the first time ever. He's able to run and play. No more asthma, no more medication, I'm sure. And then
I'm
we had a
having
couple of
goosebumps. I'm having goosebumps.
we had goosebumps too.
Yeah.
So we said, what, I wonder how many kids with asthma have a history of not bonding. And we did 3 studies. And the studies show that we had 30 mothers and kids in each of the groups. And in the group of normal kids, no asthma, non-bonding seems to occur about 25% of the time in this study. By comparison, the asthma kids, 85% of them didn't bond with their mothers. 85%. And both
It's so
studies were the
much.
same. The first was the low 20s were kids without asthma and a low 80s kids with asthma. So we were convinced. And then we started wondering how many of these kids with asthma can really be cured, with bonding therapy. And the bonding therapy we discovered was just really simple. Find out what the impediment to falling in love with their baby at birth was. Find out what that impediment is. It could be removal from the mom or the mom going through some grief. Clean up and heal the impediments, the non-bonding events, and then have mom imagine a new birth. We treated 37 kids. 31 of them got better. The 6 who didn't get better were all teenagers who don't give a darn about being connected with their parents anymore. They're on their way out. But all of the kids, even infants got better. Let me give you an example. A mom was in a high school where they allowed mothers to bring their babies to class. And she brought her baby to class. And the reason that this baby had asthma was real clear. Her mother and father were ashamed of her that she got pregnant when she was 15. So they shipped her off to an aunt in the Midwest. And the aunt was also ashamed of her and filled her with guilt. Mom came back. Mom delivered the baby back east, came back, and her baby had asthma. So it was real easy having her imagine getting rid of all of that guilt that was laid on her by her family, and then imagine a new birth. And within a week, the baby's asthma was resolved.
A week.
within a week.
A
Yeah.
week. Yeah.
So the treatment of non-bonding, the treatment for a mother who didn't bond with their baby is real simple. You find out what the non-bonding event was. It's either they were separated from their babies at birth, or there was something going on in their own lives that was very painful. Something like they lost a parent, they broke up with their boyfriend, they're strung out on drugs, they're going through some physical problems of themselves, or they are extremely depressed. And when you find out what the non-bonding event is, you heal it. And most of the time, it's already healed with the long period of time that's elapsed since the birth. And if it isn't healed, then you heal it through any means you have. You heal it through, and we do it through hypnosis and EMDR. You could heal it through art therapy. You could heal it through prayer. You could heal it through meditation, but any way that's possible to heal it. And as you reminded me, a mother who doesn't bond lies in the weeds waiting for an opportunity.
I thought it was you who told me about this, like that how we're all designed innately to bond.
That's exactly it.
And it's that something gets in the way, and
Yeah.
that's what you've been doing with the bonding therapy,
Yeah.
is
Something gets in
really
the way.
healing the
And the other
trauma.
things that get in the way, Klaus and Kennel, these two guys from Case Western, they say that if a mother has twins, most likely she'll bond with one, but not the other. And if a mother has a C-section delivery, chances are she's not going to bond. And if a mother is medicated so much that she doesn't know what's going on, she most likely is not going to bond. We have some mothers who say, they doped me up so much that I couldn't tell if it was a boy or a girl, and I just wanted to go to sleep.
Wow.
So after you clear the non-bonding event, then you have them imagine a new birth, a new birth. I had a mother, before I knew about all this, I had a mother in therapy whose kid was failing to thrive. The child would go to the hospital, not and put on weight, come back home, lose weight, back and forth 5 or 6 times. The hospital sent the mother and father over to me, and I did what I could. The mother said that her father died during the pregnancy.
Oh.
So I helped her get over that grief, but I didn't have her go through a new birth. And without that, the kid didn't get any better. So having a new birth is essential.
And you, Tony, you actually go through each, well, each process. I think conception, each trimester.
Yes.
Tell
Uh,
us a little more, share a bit more about that.
when I have them imagine a new birth, I say, imagine what it's like without all of this grief to find out you're pregnant and to be happy about that. And when you're happy about that, nod or tell me. And then go through the first trimester. And at the end of the first trimester, everything is okay. Let me know. Second trimester, third trimester. And then the baby's born quick and easy.
Yes.
And you hold the baby. And when you know that, nod. And then I say, and the baby knows you, knows your heartbeat, knows the sound of your voice, knows what you sound like, and you know the baby. And when you know all of that, nod. And then you nurse and you go to sleep with the baby. And then after a while, you go home. So and they can go through that very, very quickly. That's something that they've wanted for a long time. The thing we found out accidentally, how much time do we got, Veronique?
We have about 5 minutes.
Okay, I'll go quick and dirty through this one. The
Okay.
it happens to mothers who don't bond and the kid doesn't have asthma, but they just know that there's something wrong. I was teaching at the University of San Francisco about this, and one of the mothers raised her hand. She says, one of the students raised her hand. She says, I have an 8-year-old daughter. She's a wonderful daughter. Everybody loves her intensely except me. There's something missing. And I think I know what it is now. My brother died during the pregnancy. She says, can that get fixed? And I says, well, let's see. So hypnotized her, remove any of the sadness that was involved about her brother dying, and then have her imagine being pregnant when she was happy through the pregnancy. That was the last class of the semester. And a couple of years later, I was recruiting um, kids for our next asthma study, and I was recruiting them uh, at a counselor meeting, a counselor group. And this lady raises her hand. She says, "Hey, everybody, this works." She says, "I had an 8-year-old daughter, didn't really love her to pieces, did 10 minutes of rebonding, and my daughter and I have been like this ever since. And it's been 10 years. So it works with non-asthma cases. We've had a number of mothers come in and say, there's something wrong. Oh, here's a great one. I got
Okay.
this mother and daughter are in counseling somewhere else. They've been in counseling for a long time. The daughter's 12. And when the daughter started beating up the mother, the counselor said, I think this is a little bit more serious than I can handle. Why don't you go see those guys over at Redwood Psychology Center? I think it has to do with bonding. So the mother comes in, we say, what? Oh, the mother comes in, we see her in the waiting room. The mother and the daughter are screaming at one another across a crowded waiting room, screaming at one another. So we get the mother and say, what happened at birth? She says, I was in jail. I delivered in jail. They gave the baby to my mother, who took care of her for 6 more months until I got out of jail. She said, what were you in jail for? She says, drugs. And she says, but I'm clean and sober now. So he says, oh, okay. So we got her up, had her imagine this birth without drugs, and the baby could stay with you. The next week, they come in for the next session of therapy. The daughter is lying on the couch across her mother's lap. And the mother's petting her head. It worked. It worked. Okay.
Yeah, it's what's amazing is how many different ways that this bonding can get interfered with, and how normalizing and non-judgmental and supportive this perspective is about it not being the mother or the child's fault, it not being anyone's
Exactly.
fault.
Exactly. It's an accident. And for those of us
Yeah,
who are, transpersonal and psychogenetic and all of that stuff, accidents don't occur, but accidents do occur. An accident of birth, it's not the mom's fault, and
yeah,
it's not the kid's fault.
yeah. I think this could be a good landing place.
Okay,
How about you tell folks where they can find you or reach you?
sure. They can find me by emailing me madrid@sonic.net, or they can phone the clinic at 707-865-1200.
And you have a website. Is it asthmabusters.com?
I think now it's MIB Sonoma at Weebly.com. Yeah, that's it. MIB Sonoma at Weebly.com
For maternal infant bonding,
for
MIB.
information about maternal infant bonding. Yeah.
Yeah, and you also have a training manual. You've written a book that's
Uh-huh.
available on Amazon, and you have a lot of over 30 publications and a lot of resources, including a booklet and more
Hmm.
information.
Yeah, if a therapist wants to know about this, he can learn about it very, very quickly. Just contact me and I'll turn him to the places where he can learn it.
Or she might too.
Or she might too.
Great. Thank you
Thanks,
so
Veronique.
much, Tony, for
Thank you,
joining
Veronique.
me
This was a
here.
pleasure. Bye.
Bye.